Hi there. Hi, I have a Smokey and Bandit to see Dr. Jeff.
Okay. If you want to have a seat, I'll let him know you're here.
Okay, thank you.
3-week-old kittens, Smokey and Bandit, were found abandoned 30 miles outside of Denver by a rescue group. Taylor volunteered to foster them.
Smokey and Bandit get into absolutely everything. I can't keep them in a container at all. They're escape artists. So just curious little bundles of energy that are really, really fun to see grow. They came in today because they're losing weight, and we just want to make sure that it's not indicative of something like they're getting sick.
Hi.
Hi there.
I'm Jeff.
My name's Taylor.
Which is which here?
Smokey is the tabby, and Bandit is the tuxedo.
Okay. Oh, they're really small.
They are. They're very small.
Where's Mom?
Not in the picture.
Okay, that's a problem. And I assume they've had diarrhea for a little bit?
Yes.
Pretty pasty. All right. Well, you got to understand that with kittens, I don't know, I call it fading kitten syndrome. Bottom line is you can have very healthy kittens and all of a sudden they just bloat and die. It can be tough. Smokey had a real pasty, kind of white chalky diarrhea. Basically, that's, the bacteria of the gut have changed dramatically. With kittens, it's all about balance. They need their mother's milk, and they really need to be with their mom till 8 weeks of age. If you get them on food too soon, it really messes up the bacteria flora in their gut. And their gut is very important in the immune system. So we're gonna deworm them, and we're gonna put them on Albon. Good stuff. Yum, 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 yum. Anytime you have diarrhea, for kittens in particular, Albon it just seems to really help with the bacteria flora. I couldn't tell this one, he had a big poop ball. Come here, babe.
That one's the talker, for sure.
Okay, that's good stuff.
Yeah.
Yeah. We need to get the diarrhea cleared up. It's usually a bacteria overgrowth, and you don't even know it's coming. It just hits you.
Oh, no. Needs some serious cleanup. I'm sorry. Jeez. These poor little kittens. The area stays wet, and it gets super sore.
All we can do at this point is do the things that we know is supportive and keep our fingers crossed. So we put a little Dermalone on their behind, especially the one, because they get a little raw.
Yeah.
Thank you very much. Appreciate it.
Yep.
Are both legs broken?
No. We took her to the vocal vet and he did x-rays and everything, and her bone socket is shattered.
JEANA has driven all night from Iowa to try and save her puppy's leg.
They suggested amputation, but I didn't want to, do that. And they called me back from this place. I'm praying they can fix her. She's only 12 weeks old. It's okay, Ray. It's okay.
We live in the country, in the middle of nowhere, and a car happened to be coming flying down the hill.
Howdy, I'm Dr. B. I had a chance to take a look at the x-rays.
I don't want to take her leg if we don't have to.
Here's the thing, is I think we can try to get this fixed, and she gets to keep the leg. But I do need to talk with Dr. Jeff, make sure that he thinks that he can pull this off.
Okay.
Dr. Jeff and I need to put our heads together and see what we can come up with, because that fracture is going to be a problem.
She's wonderful. She's the most beautiful dog we have ever had, and I'm doing everything I can to give her the best quality of life I can give her. I don't feel right amputating it without exhausting all my options.
Jeff's back from the festival in time to look at REYA'S x-rays.
So 3-month-old lab puppy hit by a car. You can see the top of the fracture.
This should be sitting right in there. Basically, the cap's been pulled off. That's not going to be an easy one to fix.
And then we have this view of the tibial fracture. The vet in her hometown wasn't willing to take that on.
We'll try to put an IM pin in and cast it, but this is a really bad break. So this is a ball and socket joint and it sits in the hip socket. This one's actually cracked. Basically, this leg has gone up and it's sitting way up here. It's moved up and kind of into the butt area. So we're gonna go up there, make this nice and smooth, take this out in here, push this leg back down,
and basically suture it in more or less in the right area. The tibia is broken too, and it happens to be on the same leg, so we're just going to put an IM pin in here and then put a cast on this. This should be healed up in 4 to 6 weeks easily. She is a puppy, and it's amazing how fast they use the legs.
She appears that she's doing great.
5 days after surgery to repair her broken leg, Ray is nearly ready to go home. Vet tech Shelly has just one last task.
You hungry? I'm gonna hand feed her her pills to make sure she does get her pain medication. She knows there's something in here that she doesn't want. She just got the bitterness of one of the pills. Oh no, I can't see. Thank you. The ones that I can see on her right leg, they look really good. I think she just wants to be held and wants love right now, which is fine by me.
Rhea is ready to go home to Iowa with her owner, JEANA.
Which foot is he laying on? Can you put him on the ground for a second? So he's using it. Hey, buddy.
You're super cute.
He is super cute. He's like a little fox dog.
Mm-hmm.
Oh no, what am I doing? I'm not actually convinced that's broken. So I think we're probably better off taking x-rays and having a feel under sedation.
Okay.
Just to make sure we're not missing something minor.
Let's go. Go talk to your mom.
Yeah.
I will give you your baby.
Hey, baby.
This is Dr. KRAFT.
We've taken a look at Lonzo and we're not seeing anything super obvious. So what I'd like to do is to take x-rays, and that way I can confirm that even asleep there's no motion in that kind of piece of bone. I'm not getting it to move while he's awake. And then if I am getting a little wiggle, a splint, to fix it. All right, so expect a call on that in a little bit.
Okay, sounds good.
Cool. He's so cute.
I'm like, oh my God, like this is my puppy, this is my baby. I need to take care of him.
All right, little Lonzo. With Zoe, he had an injury at home, so we're gonna take x-rays just to be sure, yes or no, that he's got a broken bone.
I'm so scared.
Good.
He's so vicious, man.
With Zoe relaxed, we can get a really good feel of what's happening in his bone. And the piece we're looking at is actually the bony point on the shin. It's called the tibial crest. If it moves, then it is broken. And I am getting motion in there. You can see that there has been some injury. The thing that's abnormal about it is we have a little bit of a white line where there should be a clear space. The best plan is going to be to make sure that it has no further change and can heal completely. So what we'll do today is to put 2 pins in there just to prevent it from shifting any further, and it should do really well. I have to call them now.
Hello?
Hey, this is Dr. Don.
Hi.
I was just calling about Zoe and wanted you to know that there definitely was an injury. So I think we should probably put a pin in there just to completely make sure that that piece has no chance to move over the rest of the healing. So I think we need to just do a little extra stability in there.
About 1.5 years ago, my son came to me and said, "Mommy, we have a big white rabbit in our yard." And I was like, "What?" And I go and look out the window, and sure enough, she was in our yard. And she's been there ever since. I noticed that she started having some growths on her body that didn't look good. My concern actually was cancer. Pretty worried about her. She means a lot to the family.
Can I see Snow, please?
Right here.
All right, let's come on this way. How are things today?
Good. Rebecca.
Nice to meet you.
Nice to meet you.
And Snow's hiding down there.
Yeah. So about 1.5 years ago, Snow wandered into our backyard. At one point, I did have her in a hutch, but being the stinker that she is, she dug herself out from under it.
Oh, wow.
Yeah, she found a little spot under our deck that she goes when it snows to stay warm and when it's hot to stay cool. And she will come and kind of sit on my lap. She'll let me pet her. She'll eat treats out of my hand. Actually, one of the sweetest bunnies I've ever had.
Okay.
I noticed these little black bugs embedding in her ears.
Okay.
And I had no idea what they were. But that's kind of secondary because the last probably 2 weeks I've noticed she has these little growths starting to grow on her body. They're not looking good. They're growing very quickly.
Okay.
And they're growing very large.
There we go.
It's hard to get her in there, and then when she's in there, she doesn't want to come out.
Yeah.
You can see the little bugs.
Oh, yeah. I think those are fleas. Yeah, those are definitely fleas, looking at them. Yeah.
You're okay. You're okay.
Hang on, Snow.
You're okay.
You may need to get some flea spray that's safe for puppies and kittens.
Okay. And then you could see the growth. Right, that's one of them, and then she has another one on her other side. What is that?
It's not a growth. It is what's known as a cuterebra.
What is that?
A cuterebra is a fly larva.
Oh, lovely.
Yeah. It's being a little stubborn about coming out here.
Yuck.
A nice big one. Lovely things, aren't they?
Ah, gorgeous.
It's a fly larva. The eggs burrow into the skin, make a little nice pocket for themselves to hang out, and then they turn into the fly and go away. The fly larvae are harmless to the host, but they can cause problems like infections, things like that. So we want to get rid of them. You just squeeze on them to get the larva out. So there's another one of those. Oh, yep, right there. That was a really, really big bot larva. I think the biggest one I've ever seen.
Hi, buddy. He's cold. We'll get you all taken care of.
A guy dropped off a baby squirrel in a box.
Come on, little guy.
We've had everything dropped off from raccoons, baby bunnies, lots of different birds. We had a hawk the other day, but definitely my favorite is the squirrels. My dad helped rehab some squirrels when I was a little kid, and I just kind of fell in love with them then. Dr. B, come here. Okay.
Scared?
He's scared.
Is there anything wrong with this one?
No, the landscape worker, and they were cutting down a whole bunch of pine trees.
Oh, and
he was the only one that was there. They said they saw no other ones, no nests anywhere. He was laying up along a fence.
Okay.
He was freezing cold.
They probably cut his tree down.
Yeah. Dr. B will assess them as they come in, then they all go to the rehabilitation center.
Oh, okay.
Let go.
I'll go over the towel. No teeth yet. That's good.
Oh, you're okay. You're okay.
Stop petting the squirrel. I want him to be a wild squirrel. I think that's a boy squirrel. I'll get in touch with Greenwood and
We'll get him there.
get this little squirrel there.
Greenwood is a rehabilitation center that takes really anything that we come across, pretty much as long as they're over a certain weight limit, which is 80 grams, then they take them, they rehab them. Once they're healthy enough and get big enough, then they can re-release them.
Okay.
All right, little man. Come here, baby. I would keep the squirrels, but Dr. B would report me to the state and I'd get in trouble.
Wild animals should stay wild.
I know, but they're so cute.